Okay. So we have several objectives for this webinar. For this 1.5 hours, we're only focusing on the first 2 objectives. If you notice in the flyer, there were more objectives. Those objectives will play out as you go forward with your project ones. So for this one, we are focusing on a bit of a theoretical background to this issue of what is a complex adaptive system and how does it affect the way we think through implementing and evaluating interventions and even doing research in such systems, and then facilitate the application of this theory in our project ones. Okay, and I'll briefly talk about context. Now, when we talk about context, we are talking about the context is the surrounding circumstances in which an event occurs. So really, context is a bit relativist in its definition, in that it's relative to what you are interested in. If you are, for example, interested in how are decisions made at the household level as to what to do when someone falls ill, the context of your exploration of the immediate micro context of your exploration of that factor may be the community in which the household is located. You may want to go beyond that to the meso context of the district in which it is located and to the macro context of the country in which it is located. Whereas if what you are interested in is how are agendas set for global policies that affect urban health, the nature of your question is that an immediate context will be the whole global scenario of the agencies and the stakeholders who are active at the global level in global agenda setting. There are several frameworks in the literature for trying to categorize a bit and describe context. Because of the time, I just chose one, but you really don't need to stick to it. And I can share others with you, with those who want to delve a bit deeper into this issue of context. For the purposes of today, I've just chosen Lichter's framework, which was used in a comparative approach to policy analysis, where he talks about the environmental context, which are factors external to a country, such as the international political environment, agreements, etc. Then he talks about the situational context, which is the environmental context is can be a bit more stable. The situational context has to do with more transient things, like COVID-19 is really a situational contextual factor. It's not part of things as they are. Sometimes situational context can move to become environmental context. If, for example, you take the initial innovations around the World Wide Web, at that time, they were more situational. Where are they going to be permanent? But now the World Wide Web is part of a permanent feature of our lives. It has moved from situational context to environmental context. So again, it can be a bit fluid. So you also relate it to the point in time in which you are investigating an issue. Okay. Then you have the structural context, which are more permanent and persistent features of a system. You know, the economic base, the political institutions, the demographic structures. And then you have the cultural and the socio-political context. And culture refers to ways of doing things. So when you are looking at cultural and socio-political context, you're also looking at value commitments of groups in the community, in the nation, globally, and so on. So I've just chosen one framework just to illustrate the fact that there are frameworks out there for trying to think through context. And you don't need to stick to any one framework. You can even study the different frameworks and try and come out with your own classification. The important thing is to recognize that context does matter when you are trying to understand some and work within some of the issues we are talking about. Now, I'll talk about what we mean when we talk about a complex adaptive system. Now, a system generally is something that is made of more than one component, and where when the components come together, you get a value that is greater than the sum of the individual components. If I can try and carve out a definition. So for example, a lock and key is a very simple system. If you the lock and the key together create something that you can use to open or shut something, lock it up. The key has a value, is actually not as valuable. A key alone without the lock is not quite so valuable, and a lock alone without the key is not so valuable. It's when the two come together that you have a valuable simple system. So that we often say that in systems, the sum of the parts combined are greater than the value of the individual parts. A more complex mechanical system would be a car. Again, if you have the body of a car and you have the engine and you have the seats and so on, it doesn't have quite the same value as when you pull it all together and you have a machine that can move. Now, complex adaptive systems go beyond. Mechanical systems like a car are relatively simple. You can't predict what will happen if you join wire A to wire B in the correct sequence. Complex adaptive systems are more difficult. They are not completely predictable, and I'm going to go into a bit of these issues. They are characterized by path dependence. By path dependence, what we mean is that history matters. And sometimes the paths, if you set out down one path, it becomes harder and harder to reverse the pathway. So, for example, you'll see that nations have different insurance systems. It's part of it is path dependent. Germany started with Bismarck in 18-something, and they've continued down that route. The UK took a particular model with the National Health Service, and they've continued down that route. Now, those are not the only models, but the further you go down a route, the harder it can become for a country to reverse without, some radical kind of revolution. It's the same with health systems. If in your health system, everything is structured so that we are all using let me take a really simple example. Everything is structured to use Microsoft Office. And then somebody suddenly comes up with a whole brand new software that is superior performing. It may be very difficult for the whole organization to change its systems and move to that software. A classical example is the keyboard we currently use on computers, typewriters, and so on. The arrangement of the letters is not necessarily the most instinctive, logical arrangement, but that is what the whole world is used to. To ask the world to change the keyboard is going to be difficult. Okay, so that's path, and you need to be aware that history matters. So sometimes when you are trying to study phenomena, create interventions in a system, you do need to pay attention to the path dependence. Why is this country paying for healthcare this way? It may be hard to change, to just suggest a radical change without understanding it. Then you have feedback loops where an action in one part of the system sends a message which triggers another response in another part of the system, which may either reinforce the first action or dampen it. Again, complex adaptive systems have that. When I finish the theory, I'll use a real case study to illustrate. And then you have emergent behavior, things that were not there when you started intervening, which start popping up when you start intervening. It's characteristic of complex adaptive systems. Then you also have what are called phase transitions or tipping points or triggers. These are critical points at which radical change takes place. In fact, complex adaptive systems can be very stable, but if you get to a radical phase transition, you can get change. And an example I can use in Ghana is for a long time, since 85, we had user fees, and everybody would make these user fees are inequitable, we're uncomfortable, the research is showing it. And it had an increasing groundswell of social complaints, media complaints, but then So phase transitions are sometimes windows of opportunity, but then there was also not enough knowledge to know what to do next. And again, that's where history matters. The country was coming from a British colonial background where we were trying to do a tax-funded system, and then you find you are not raising enough taxes for such a system. So user fees are introduced. You needed a point in time where several things came together and became a tipping point where the groundswell of complaints about out-of-pocket payments, the horror stories about people dying on trolleys because there's nobody to pay, then the politics also jumps in where now it becomes part of election campaigns. We will get rid of this system. And then you have the research which has been growing over the years of what works and what does not work if you want to do health insurance in such a country. And finally, it became a tipping point. And that tipping point was a contribution of all these things, the path dependence, the emergent behavior, because without the user fees and the discomfort, people would not have seen insurance premiums and taxes for insurance as a much better option. Then finally, we have scale-free networks, and I'll explain a bit with this, which is taken from a paper by Barabasi and Bonabo. In fact, they studied, I think they studied in IT, but basically what they are saying is that classically, what we know about random networks is the typical bell-shaped curve. So that if each of the nodes in the first map here is connected to a predictable number of nodes, they have some which are connected to many nodes, you have many which are connected to few, you just get a bell-shaped curve. Now, random networks, you can shake them more easily. If you knock out a few nodes, you can disrupt the network. Now, you have another kind of network, which is called a scale-free network. In a scale-free network, you have a few nodes that have many, many, many connections. And then you have many nodes that have only a few connections. And the World Wide Web is a very good example. So that there are websites like Google, which have multiple connections. And then you have my website probably has only a few connections. You could knock it out and nobody would notice you knocked out my website, that kind of thing. So what happens is that such networks can be very stable, but if you want to disrupt them, if you touch a key node, you can totally disrupt the network. But until you touch a key node, it's incredibly stable. So complex adaptive systems often show this scale-free network characteristics. It can be very hard to shake the system to bring about change unless you really hit a key node. And it comes back to when you hit a key node, then you may manage to get a phase transition and a tipping point. Why does all this theory matters? Because up to now, I've really been talking a lot of complex adaptive system theory. It matters because, like I said, the health system is a complex adaptive system, and central to the complexity of the health system is people in diverse roles, decision makers, frontline providers, and so on. That's why the health system is not a mechanical system, it's a social system, and it's complex. So I've just listed some of the rules. You've been doing stakeholder analysis, so I'm sure you can come out with more, but that's why stakeholder analysis matters, to understand who are the people, what are their interests, their power, their influence, their ideas, their values, and so on. And then the health system is complex. The WHO building blocks is very popular, and often that's the framework that people are using. There are actually many more next generation frameworks out there that are more comprehensive. Even the original WHO framework now has people in the center and the building blocks around it. Because of time, I didn't project all these multiple frameworks. I just project one where you could think of the WHO building blocks, but if you think of the health system as a shelter for the health of the population, the building blocks are really the foundation of the shelter. And the context is the ground on which the foundation is laid. but it's also the situation to which the building is exposed over time. And then the motor are the people, their interests, their trust. And if you know anything about buildings, if the foundation makes the difference between whether the buildings withstand stress or not, then the pillars are the values, equity, justice, fairness, rights, responsibility, responsiveness. And finally, the roof is the programs and the interventions, things like delivery, access, quality, utilization. I've chosen this framework because a lot of times people will focus on the programs and the interventions, but for a roof to be of any use, it has to rest on pillars and on a foundation, and you have to take into account the context in which the building is built. So again, this is to provoke you to think a bit as you design your projects. Many of the project ones are focused on issues around delivery, access, quality, utilization. But you cannot really deal with these issues without paying attention to the whole. Okay, so another way of saying this, and I've borrowed a Nigerian proverb, which says that a goat that belongs to the whole village belongs to nobody. And health systems are a bit like that. All programs need the health system. So sometimes if you're not careful, nobody pays attention to the health system until the day it's time for the village feast. And we realized that actually nobody was looking out for that goat, and the goat cannot be found. So again, this is just to draw attention to the fact that regardless of what you are interested in doing within the health system, it's good to keep in your mind that the system as a whole is going to affect your ability to do or not do and to sustain. So I'll just do a quick illustration from a real case study that occurred in Ghana, and I'll be really fast because we are running out of time. I shared the paper, I can read it on your own. But back in about 1998, the average monthly basic salary for junior and senior doctors in Ghana was about $199 per month for a junior doctor just starting, $272 respectively. And not surprisingly, and especially since the official language, the language of training, education is English, as soon as the people finish medical school, they just take the UK PLAB or the USMLE or something and they're out of there. So that between 86 and 95, over half of doctors from the country means medical schools just immigrated, US, UK, South Africa. It was a real problem. And then you had high client to public sector workloads. So again, you can see quite what the gradients were. A few years before the events described here, doctors had fought without success for overtime payments, those who chose to stay in the country. And it made no difference. Then what happened in 1998 is that the military hospital, which is a quasi-governmental hospital, I think they were really worried about losing all their doctors. The military is such a key. So they unilaterally, quietly increased wages. And again, in a system, there's nothing like I'm quietly intervening and nothing happens elsewhere. We'll talk about intended and unintended effects. The intended effect was to at least stop the doctors in military hospital from emigrating so fast. The unintended effect was that all the other doctors in the country sat up and said, hang on, if you can do it for one group of doctors, you are going to do it for all of us. And so they just downed their tools. And then the knee-jerk reaction, and you will do knee-jerk reactions if you don't stop to study a system, was, oh, how many doctors are left in Ghana? It's only 1,000. Let's pay them more so that they come off the strike and everybody is happy. I'll move straight to the diagram and skip all this. So this is a causal loop diagram, which shows what I'm talking about. I talk about feedback loops. So you have the trigger event here in the center, which is the 37 military hospital pay rise for their doctors, which then had a negative effect that it further dampened already severe doctor satisfaction. It further dampened doctor satisfaction and pushed them to a strike. The reaction to the strike was to give additional duty hours. We'll pay you for overtime. We are not changing salaries, we'll pay you for overtime. Then the doctors are satisfied. But then doctors don't work alone in a system, they work with a team. So the nurses took a look and thought, hey, hang on, we are also struggling in this system where we are so poorly paid. So they also downed their tools, and they are about 40% of the workforce. Again, the sector ground to a halt. And again, government added nurses to it. And then, of course, nurses don't work alone. They work with administrators, accountants, cleaners, whatever. So all the rest of the health sector thought, we may not be as important as the professionals in the eyes of the policymakers, but if we come together and form a health workers group and down our tools, the sector will grind to a halt. So they did that, and again, the sector ground to a halt. So you see these feedback loops. And then as more and more people were loaded onto the system in a country which is already struggling with its budgets, you began to get pay delays. And then the pay delays created another feedback loop of everybody is dissatisfied, and now the whole sector grinds to a halt and government rushes to find the money. So I've just chosen this example. I can tell you the end of the story. In fact, in the end, government did the system-wide intervention they'd run away from for years and sat down and rationalized salaries and said, okay, let's be realistic. And then that brought this to to a calm. It created a new generation of issues, but I'm not going to talk about them. I've just used this to illustrate all the points I've made. This was a big national scale one, but even in your project one, whatever intervention you are thinking about, your baseline and so on, you do need to keep these issues in mind. They occur at the micro, the meso, and the macro level. Okay, I'll skip everything else. I've shared the slides with you, and I want to introduce the small group breakouts, but I'll pause in case there's any clarification or it's clear. We are good, and we can go into the breakout rooms, and we can also discuss further in the breakout rooms. I'll pause for a minute.